Pulmonary embolism. Nursing care plan. Pulmonary embolism, PE, is a blockage of an artery in the lungs by a substance that is moved from elsewhere in the body through the bloodstream. Pulmonary embolus occurs from a fibrin or blood clot. Most commonly, emboli are detached thrombi from the deep veins of the legs. Emboli also usually result from air entering the circulatory system through intravascular catheters. Fat emboli occur with long bone fractures. Signs and symptoms: fever, hemoptysis, dizziness, chest pain. On physical assessment, there will be restlessness and anxiety. On checking vital signs, you will have normal or increased BP as a result of anxiety. Normal or increased heart rate greater than 100 beats a minute. Increase respiratory rate. Assessment: assess respiratory status, note rate and depth of respirations, observe for dyspnea and restlessness. Hypoxia may be manifested as increased restlessness or change in level of consciousness and respiratory rate greater than 30 breaths a minute. Auscultate breath sounds such as crackles. Pain assessment. Nursing diagnosis: impaired gas exchange related to ventilation perfusion mismatch or hyperventilation secondary to pain. Planing: alert and oriented, respiratory rate 12 to 20 breaths a minute, absence of adventitious breath sounds. PaO2 80 to 100 mm Hg.O2 saturation 95%. Nursing intervention. Place the patient on bed rest initially and assist the patient to assume a comfortable position. Administer supplemental oxygen as ordered. Intubation and mechanical ventilation may be required. Pace activities to decrease the patient's oxygen demand, allowing adequate time for patient recovery. Administer analgesics as ordered to prevent splinting and improve chest excursion. Nursing intervention: continuously monitor oxygen saturation with pulse oximetry. Carefully monitor patient activities and interventions that may adversely affect oxygen saturation. Continuously monitor ECG for dysrhythmias or ischemic changes. Evaluation: review ABGs for changes in SOA2 and PAO2 to evaluate improvement or deterioration in the patient's pulmonary status.